Good day, everyone. I am Julia Marie Torres from the third group of BSN1A. So now we're going to perform the assessment of head and neck. Part of data collection is the gathering of biographical data of the patient. That includes the name, age, and the birth date of the patient. So now I will g- I will ask the patient, Mom, what is your name?
I am Joy Canlas,
How old are you?
19,
When is your birthday?
two, 2004 March 14.
Okay, thank you. Upon gathering the biographical data, it is important to perform hand hygiene and provide the client's privacy. So now we're gathering the chief complaint of the patient. Um, I will ask her if what is the sign and symptoms that she is suffering right now. Mom, is there any lumps or lesions on your neck and head?
None po.
Do you experience difficulty while moving your head?
None po. Hindi po.
Do you feel headaches nowadays?
Whenever I'm stressed.
Okay. Do you feel dizziness, lightheadedness, spinning sensations, or loss of consciousness?
Lightheadedness kapag nasosobrahan ako sa tulog.
How about in your past health history? Have you had undergone surgery?
No?
Do you have any trauma or do you encounter traumatic experience such as accident?
No.
Okay. How about in your family history? Does anyone in your family have cancer on the neck or head?
None po.
Um, Also, does anyone in your family have migraine, headaches, or
Sa mga kapatid ko. Or relatives.
how are they dealing with it?
Ah,
Tulog?
I don't know. Hindi ko siya.
Okay. So, how about on your lifestyle and health practices? Do you smoke or do you have any vices? Do you drink?
Occasionally, and I don't smoke.
How about e-cigarettes or vape?
No.
Okay, good. Do you wear a helmet or a hard hat?
Yes.
When?
Kapag may rides kami or aalis na nakamotor,
Okay. What is your typical posture when you're relaxing or laying down in your bed?
typical posture, sitting, or
Nakadapa ka ba or
sa fine
nakahiga ka
position.
naman?
Sa fine position or prone position.
Okay. Do you have some recreational activities?
I don't usually go recreational activities.
Do you like dancing?
No.
Okay. So now we're going to proceed on the inspection of the patient. So the equipments that we're going to use includes the pen light, clean gloves, and a cup of water. So first, so the things that you must consider on performing the assessment of head and neck is that I will going to touch you, your head, and you are going to participate by obeying on my command. So now, I will wear the pair of gloves for my protection and also to the patient for us to be safe, to prevent serum and pus to be transferred to me. So ma'am, I'm going to touch you. Is that okay for you? Okay. So now, ma'am, I will going to inspect for the symmetry of your head and neck. So Ma'am, pwede po mag-smile, mag frown po, mag sad face po.
Mukha kayo ni Baraw.
Ano?
Oh, um, Ma'am, touch ko lang po ha. Ma'am, say ah.
Ah,
Ah,
ah.
sarado po. Ah, sarado. So, I have found out that she has symmetrical face. There is no swelling or edema found on her head. There is no tenderness on her temporal artery. Her temporomandibular jaw is normal. There is no signs of any abnormalities found on her head and neck. So now we're going to proceed for the inspection of the neck. So now I am going to use my pen light to light up the surface if there is any lesions or any edema present in her neck. So she can participate on what I am going to do by obeying my command. So ma'am, can you please flex your neck? Yung side one. So the next step is to check the cricoid and thyroid cartilage by allowing the patient to swallow a sip of water. So now I am here with my cup of water. So ma'am, can you please sip a little bit of water for me? Okay. Thank you. I have observed that the movement of her thyroid and cricoid cartilage is symmetry, and it means that is normal. She have normal throat and her neck is symmetrical. So ma'am, can you please flex your neck in? Because I am going to check your back, the back of your neck, your nape. Is it okay for you? Okay.
C7.
So mom, you can straight forward ahead. So now I have observed that her cervical vertebrae are normal. There is no swelling or signs of edema, which means that there is no abnormalities. So the next thing we're going to perform is to check if the range of motion of her neck is normal. So by doing that, by performing that, we're going to ask the patient to cooperate with your command. So mom, can you please move your head on your to your shoulder? Mom, can you please Mom, can you please move your head to your shoulder? Can you please move your ear to your shoulder? Move your neck to the ceiling. Look at the ceiling. Okay. And then, can you please put your chin to your shoulder? How about your ears to your shoulder? Okay, thank you. So, ma'am, I am going to check your neck, ha? It'll be a little bit sensitive. It'll be a little bit sensitive for you. Is it okay? Okay. Ma'am, touch ko lang po, ha? So, for the thyroid gland. Okay. So, I have found out that there is no any enlargement on her thyroid gland. So, that means there is no need to auscultate it. It's for the checking of the lymph nodes. So, now, I am going to start with her preauricular lymph nodes. So, ma'am, I am going to palpate, ha? Okay. But preauricular nodes. Tapos, auricular nodes. Occipital nodes. This tonsillar node. The submandibular, segmental, deep posterior cervical lymph nodes, and then the supraclavicular lymph nodes, and the infraclavicular lymph nodes. Upon checking her lymph node, I have found out that there is no any enlargement, which means that her lymph nodes is normal and there is no infections on her body. So to conclude the assessment of head and neck, the head is normal, the neck is normal, she is mobilized, her neck moves freely and smoothly according to the command I am giving to her, and to conclude, the findings are all normal. So again, I am Julia Marie Torres from the third group of DSN-1A, have assessed the head and neck of my practice patient Joy Canlas. Thank you and have a nice day ahead.